Hello friends, let us now learn some important points about 4 different lists of diseases which are important. First, diseases under international surveillance in WHO. These include seven diseases. 1. 2 fevers: louse-borne typhus fever and relapsing fever. Louse-borne typhus fever and relapsing fever. Then we have important diseases in India: poliomyelitis and malaria. Then the diseases which have human influenza disease, which is aerosol, rabies and salmonellosis. So these are the diseases under international surveillance. They are louse-borne typhus fever, relapsing fever, human influenza fever, salmonellosis, poliomyelitis, malaria and rabies. Now, topical diseases targeted for research and training. Topical diseases targeted for research and training includes trypanosomiasis. All these are tropical diseases. So these are the diseases which are vector borne, like trypanosomiasis, filariasis, schistosomiasis, leishmaniasis, malaria and leprosy. Then diseases under international health regulations. Diseases under international health regulations include cholera, plague, yellow fever, wild poliomyelitis, human influenza virus, poliomyelitis, human influenza virus, SARS and smallpox. These are the diseases under international health regulation. List of quarantinable diseases include in the list of quarantinable diseases according to Center of Disease Control, we have diphtheria. These include diphtheria, plague, yellow fever, smallpox, infectious tuberculosis and viral hemorrhagic fever. These are the different lists of diseases which are very important. Thank you for watching my lecture. Thank you.